Hello, Dr. Bracho. Welcome to the International Dentist Podcast.
Hi, how are you, Dr. Lagreca? So good to see you again after such a long time.
I know I missed you, so I can't wait to.
I actually miss the cold weather right now in Florida. It's the middle of winter and we're in the 80s. So it doesn't really feel like winter.
If it helps you, we have been having a very nice winter this year so far, so we can't complain. But today is one of those super rainy days to stay in pajamas. So
No, it's okay. The fact that the changes and it just makes it, I miss that here. It's like hot, hotter, less hot, but hot.
but tell me a little bit, where in Florida are you now?
I live in Orlando. Well, I actually live in Winter Park, but that's sort of outside of the greater Orlando area. I have my own practice in Orlando, Vista area, so that's closer to the airport. I've I've had my practice for 3 years now. I joined another pediatric dentist who's actually Venezuelan as well. He's older than me, and I coincidentally met him here. We have a very nice relationship. Kind of work very similarly in the way we treat patients, our diagnosis, our treatment plans, and everything. So we did a very good match, and we opened an office 3 years ago.
Okay. What was before when you moved to the United States? What were those first steps to get to where you are right now? Maybe just a little summary.
Okay, so in a little summary, I moved to the United States. It's next January. It's going to be 12 years ago. After a year that I had graduated dental school in Venezuela, coming here very naively, knowing that there was some boards that you had to pass, and that was pretty much all I knew. So I'm so glad that resources like this exist now to kind of guide people that are coming because I had to like navigate this by myself and sort of figure it out. But long story short, I knew that I wanted to do my residency. Wasn't really sure as to what I wanted to do. Um, Either an AEDD, like for furthering my just general dentistry, knowledge, or doing a specialty. And I was in between ortho and pedo. I kind of liked the growth part of dentistry, so I knew I wanted to be in that area. Uh, I started working as a dental assistant because it's the one thing that you can do without furthering your education. You can straight go to that. So I started working, and I started working with an orthodontist who, Dr. D.D.S, amazing. He's from Mexico, but uh, grew up in Miami, the Miami area. And he sort of guided me a little bit into, the different specialties, the different challenges to each specialty. Um, and I said ortho, and he said, listen, ortho is pretty competitive within the US alone. So you might want to try pedo if you like that area as well. And depending on the program you end up, there are programs that, focus a lot on interceptive orthodontics, and maybe you can kind of go. So he helped me find out that. So I took the boards, I took the part one, but in the program that I actually ended up matching, I didn't need to have those. So if you're not ready in that area, but know that you want to at least pedo, there's a lot of programs that don't require you to have the NBDEs at all. So that's a nice, because it gives you a leeway into like, okay, starting this and then maybe figuring out if you want to stay in the US, then you can do that halfway. Or if you just want to come to do your residency and go back to the country where you're from because, you have everything there. That makes it simpler. So, um, I think you guys have already touched on all the things you need to do to register as far as, and then I did my application and I matched. He was the one that actually recommended Tufts because that's where he did his dental school. He did his ortho residency in Nova, I believe, in Fort Lauderdale. And luckily enough, I had some friends that were already doing things at Tufts. So that was another way to kind of get yourself, a good interview, or, what the school in particularly is looking at, because I feel, and correct me if I'm right, because you know more about the education part of it, that most schools are looking for similar things, but each has, like, I would say, a particular thing that they're more interested in, or they're more it's more important for them. So coming from Venezuela, they had already had a couple of Venezuelan residents, but it was explaining how the dental system works in Venezuela and what it meant, this and that. And so I think for me, um, the letters of recommendation, but also that interview, I feel like that interview had a lot of weight in my acceptance. So, you got to make sure that you prepare yourself for that interview, because I want to speak from Venezuela, because I don't know the other dental or academic systems in Latin America, but I feel like that's not something we put a lot of weight into the interview. And I feel like here it's very, very important. The way that you conduct yourself, the way that you express yourself. And I'm not talking express if your English is perfect, if you have an accent or not. That's not, it's the way that you convey your message and the way that you understand the message that it's being delivered to you. So that was pretty big. And then after that, after residency, I have family. My only sister was living here in Florida. And at the time, my boyfriend at the time, now my husband, was here in Florida too, and had no interest in moving to Massachusetts, because I had been offered a position to stay teaching, and I would have wanted to stay, but again, my roots were pulling me back to Florida. And at that time, it was easier for me to stay in Florida, because with my residency, I was able to get my dental license just with the residency in the US. I didn't have to do a DMD or D.D.S. in an American school. Just those 2 years were enough. I believe that has changed now. So, unfortunately, different from what the countries in Latin America, here, the United States, it's depending on where you want to practice that the game changes. So I feel like, okay, after you know what specialty or what path in dentistry you want to take, then you got to think, okay, where do I want to live? What are the requirements there? And then sort of go from there, because after 5 years of practicing wherever you are, then you can move freely anywhere in the country. I believe California still has little here and there that they, ask a few more things, but it's more of where you wanna live. It doesn't matter where you studied, it's after that, where do you wanna live? Where do you wanna establish yourself? For whatever the reason, whether it be family, whether it be because that's where you like it, or, whatever the reason is, where you wanna live, where you wanna practice, that depends a lot on what they're gonna ask.
Yeah, especially for you, your path will have been completely different if you stay in Massachusetts, which was a state in which you couldn't practice. So you were,
Yes, I wouldn't have been able to practice. The only way for me to practice, and I say it in quotations, because I wouldn't have been able to see patients or treat patients. I would have been able to assist by teaching. And then after teaching, depending on the school, then they help you get your DMD or DDS through, programs. And then after that, um, practicing in this state. So I knew it would have been a longer road for me, not an impossible road, because a lot of people do it, but it would have been a longer road. And in my personal life, that wasn't an option. So again, that's why you got to take into consideration all the aspects, not just the professional, but the personal and all that, to decide where you're going to stay.
those are very important aspects. I'm curious to know because you started observing or assisting at ortho office, and now, of course, you own your own pedo office. Something, and I'm going to share my personal experience when I first encounter friends like you who are pedodontists in the States. that is very different. And ortho practices and pedo practices are very different to not only Venezuela, actually, many countries around the world. And there probably people don't know. And when they come with hopes and expectations of having their own practice, they're thinking certain ways in the way how they are used to see the practice of dentistry in their countries. But there are some uniqueness in these two specialties. Do you mind elaborating? Was that a shock for you? And what are those?
I mean, I not necessarily a shock, just because I didn't practice long enough in Venezuela to be able to notate a difference. And the practice that I did in Venezuela, I did it mainly in general dentistry, and I did it in community health centers. So I didn't have a private practice in order for me to kind of compare. So in a way, I guess that was beneficial for me because I didn't have anything to compare it. This is how I know a pedo or an ortho office is run, in my mind. I have now learned from experiencing treating patients that come from other countries. They're like, oh, but in my country, this, in my country, that. And, you know, sadly, you're not in that country anymore. You're here. And this is how. So to put it in a nice way, pedo and ortho offices are mainly run by quantity of patients. Not to say that you're disregarding the quality of care, but it's the quantity of patients. And I believe in ortho, it's the same reason as in pedo, but the fee, without entering in what are the amounts per se, but the fees for exams, pro fee, uh, everything are smaller or lower than you would find in general dentistry. So, in order to have a productive practice, you have to have more patients that you see daily. And the way the dentistry is practiced here in the US, you have different levels of practitioners. So starting from the dental assistant, which is, I would say, the basic, trained, to then the hygienist, which that was something I had to learn too. I don't know if it happened to you, but for us in Venezuela, the hygienist in Venezuela would be the dental assistant here.
Mhm.
So in Venezuela, we don't have what they call the hygienist here, which is actually someone that went to school for quite some time. I believe it's 2 years. They have some, knowledge on microbiology, anatomy, perio, a bunch of things where they are the ones that in general practice, and then perio practices, they do all the cleanings, maintenance for the patient and all that, which in pedo, that gets done by the dental assistant. Um,
Oh, really? So it
so
is in Peter that the dental assistant does?
yeah, I mean, you can have, um, you will find practices where they have hygienists and pedo, and this is a personal opinion of mine. Unless it's a hygienist that loves pedo and understands how to approach pedo, it just gets a little frustrating because they're trying to maintain the level of service that they provide for an adult to a 4-year-old. And you have to understand the differences in, gum tissue, the differences in dental tissue. I mean, primary teeth are not the same as permanent teeth. They have, you know, various differences and various ways you have to maintain or you have to care for them. So, um, I don't find it a necessity unless it's patients that are teenagers. And because by law, a pediatric dentist sees the patients, from the time that there's a tooth in the mouth, which is typically between 6 months to 12 months of age. And that's what the AAPD, which is the American Academy of Pediatric Dentistry, recommends to establish a dental home. It's by the time the eruption of the first tooth, no later than 12 months, by age 1, you want to make sure patients start coming to your practice until they're 18, which is legally when they stop being kids. But let's be honest, 13 above, they start having other needs. And so that's when if I encounter patients that I feel would be better managed by a general dentist, then I start referring them. Because if they have any perio issues, if they have, complex restorative cases, then it's best managed because that's not where I was trained in. So that's what makes it a little bit different. And so you have a practice where in a regular day you can see from somewhere from like 40 to 60 patients, depending on the capacity of your clinic, how many chairs you have. Think about it, in an hour, I can have 15, 14 patients in an hour because depending on the age, I have 30-minute appointments. For a 2-year-old, you don't need more than 30 minutes to do, your prophy. The actual prophy itself would take 10 minutes. The other 20 is you're doing your anticipatory guidance with your parents, you're talking, answering questions, you're doing your prevention, your caries risk assessment, all that. That's what takes time. So sometimes people would say, oh, the doctor, and I'm saying the doctor in any specialty, the doctor only saw me for 5 minutes. Well, you got to understand that it took me 8 years to be able to, in 5 minutes, see what's the issue, address it, and, move on from that. So, but I think that's why pedo practices here in the US, it's more of the quantity of patients, the amount of patients that you see compared to other specialties.
So let me ask you a question. You mentioned somewhere around 12 to 14 patients. So that means that if you have capacity in chairs, that will be what, like 7 patients per half hour approximately. So how many chairs would that be and how would that look like? You basically have the assistants helping you with the different steps and you come in and you have several procedures. Or how does that exactly work in a typical day?
So I'm going to talk about my practice. We have 9 chairs. One that is sort of like a consult post-op chair. It's closed. It's by itself. Then we have 4 chairs in what we call an open bay area, and this is pretty common also in ortho practices. You have patients the chairs are either facing each other or facing outside. In my case, it's 2 chairs facing one wall and the other 2 chairs facing the other wall, but it's basically an open area. So it also makes it easier when it's families of 3 kids. So you have them all in this area. Parents can kind of see where the kids are. Uh, and then I have 4 rooms or chairs that are closed. So I can close the doors and make it private rooms. 2 of those rooms I use for what I call treatment. So these are patients that are established. We have done an exam, we have done x-rays, we have diagnosed decay, we have a treatment plan. So I see those patients there. And then the other 2 rooms that are closed, I typically use them for patients under 3. So, patients that are going to be crying or patients that have special needs that, get a little bit more anxious in an open setting, that they need a little bit more privacy, or that they have a complex medical history. The parents want to have a little bit more privacy, don't want to be talking, you know, um, and other people might hear it, even though our chairs in the open bay area are not, they're 6 feet apart. And this is not just for COVID. This was before COVID, just because for HIPAA, you want to make sure that no one is, seeing the screen where the chart is,
Mhm.
and all that. But so in that open bay area, the assistants are basically doing the majority, which is taking x-rays, doing the prophy. They go over oral hygiene instructions, and everything. I go to those chairs 5 to 10 minutes, because I sit there, I go over x-rays with parents. I go into more detail when they're a new patient, and it's an established patient, that there's no treatment that needs to be done, no decay, no follow-up of any area that we're doing. I don't necessarily go over the x-rays every time. I just let them know, like, there is nothing. X-rays, and parents are, pretty used to, pretty happy by now. But when it's a new patient, I usually, if it's a patient that needed x-rays, because we don't take x-rays on everybody. Also, we start taking x-rays by age 4 before age 4, if there's trauma, if the parents have any concerns, if when we do the exam, we notice areas that, hey, this doesn't look right, we try to limit the exposure, even though we have digital x-rays. We know the exposure is way less, but we still try to make sure we keep our patients safe. So that's why I'm able to see those many patients. If I was the one doing the prophies and every patient doing the oral hygiene instructions and every patient doing the x-rays and every patient, I would see 10 patients a day and that was it. So
Like a general dentist will, or
like a general dentist would. And I feel like general dentists, because here's the other thing, when you come for me as a new patient, we're going to do the x-rays, we're going to do the exam, but we're also going to do the cleaning. So general dentists, majority of general dentists here in the US, they see you the first time just for x-rays and exam. And then based on that exam, they say, okay, this is the type of prophy or cleaning that you might need. And then that would be a separate appointment if they don't have the time or if they have other patients scheduled. So, you know, um, yes, it is different the way we do it because we do a little bit more. We see a little bit more patients, but it's also, we can't guarantee that if we see you that day, we're going to be able to do treatment, which sometimes the general dentist can do that. If they have enough time or if they know that you're coming because you have a certain issue or you're coming because of pain, they're going to allot enough time to be able to see you. The fact that everyone that's coming to me has an appointment, we don't do walk-ins. If I schedule someone that's coming for pain, whether it be an existing patient, which if it's an existing patient, we have to give them an appointment within the next 24 to 48 hours. If it's a patient we've never seen, we can't guarantee that we're going to do treatment that day because of how many patients we already have on our schedule. So that makes it a little bit complicated. It's a little bit frustrating for the parents that are not used to this system. I get a little feedback from parents that were not born in this country, did not go through this system themselves. Then it makes it a little bit frustrating. But
I will imagine, especially what you said, that if you're a foreigner, let's say that you, of course, you're not a dentist, so you don't need to know these things. So unless that you have gone, even if you have gone yourself as an adult patient to a dental practice, this is going to be different, right? So this environment is new, not only, and for whoever is listening, maybe you're not interested in pedo, but maybe you have children that you're going to bring to the pedodontist,
yeah,
but you don't even know what this will look like. So I think understanding that other part will help releasing much of the frustration. And as you said, the part that makes it more different is the volume, but part of the volume, and this was something that it was new to me, I didn't know that any dental treatment is covered by public insurance, because the first thing they tell you when you come to the US is that health is a problem, that there is no public health at all, and then you have to have a private insurance, which is not true. We know that there are several alternatives by states that are public. So many of these patients come from a public insurance, right, that covers dental treatment.
yes, yes. You would have to just find a practitioner that, and in my case, in the state of Florida, uh, the public insurance is Medicaid, and then there's different options. They have basically Medicaid is for medical, and then you would have different dental insurance associated to that. And in those different, we only accept one of those, and that's enough because the amount of patients we get, that everything, I want to say 99% of the treatments are covered at 100% by the insurance. Depending on the fee schedule you have with the insurance, but it is covered. You have to submit it for pre-authorization. That's the only thing, which I think most private insurances, they're not going to deny anything. I mean, you submit for a pre, but if you have to do the treatment same day, they're going to approve it because it's depending on the benefits you have with the plan that you know, purchased. So, and that's another thing that's different from I would say general dentistry or adults in general is there's no limits to the benefits.
Oh, really?
If I'm explaining it correctly, you know how in general dentistry it's like, oh, the end of the year is coming, you have X amount of, use your benefits, get that extra cleaning that you want, get that tooth whitening now. And in pedo, it's based on a calendar year. So you have 2 exams with x-rays, fluoride, cleaning, everything covered, 2 per calendar year. So
So it is by benefits, actually. It's not by monetary amount, because what happens in adult insurance is that you have, let's say, $1,000 coverage, $1,500 coverage a year. And that's where you either max out the amount or you max out the time. So that you have to use that over 12 months. But this is actually procedure. So you have several procedures covered, like guarantee cover.
yes. Mhm. Yes.
Interesting.
And all the preventative, every preventative code is going to be covered at 100% with um restorative codes, depending whether it be surgical or endo or perio or whatever. Those are also going to be covered at 100%, but you need to get a pre-D. You need to get pre-authorization for those.
Okay.
Everything else, is going to be covered at 100%. So yes, for us, it's not like, oh, run, get your appointment, by the end of the year. I feel like general dentists are busier in December. Unfortunately for us, we're busier when the school is out. If the school is out, then we're busy. And this time of year, it gets a little, well, oh, but oh, yes, we had an appointment. Yes, little Genie needs that extraction, but he has the recital, the winter recital at school today. I can not take him. Oh, okay. Yeah, because having an abscess makes a little bit more sense than, so that's
Yeah.
this time of year gets a little bit, we see more cancellations or no shows because either school or because parents want that money to go shopping. Sad, but true.
That's it. I'm thinking for somebody, and all I could think of is, of course, in a prosthodontic practice, you'll see, depends on the procedure, a patient every hour, every 90 minutes, 2 hours sometimes, or even half day if I'm doing something major. And I still feel quite exhausted at the end of the day. So what is it on your physical wellness that you do or you feel is important to do when you go home? And then what do you find when you get home? Because we haven't talked about this yet, but as a international person who's an immigrant, who has a family, is a wife, is a mother, then you go home and you keep working. So how is that balance of going home and then facing your other roles?
Yeah, that's funny because that's what I tell my staff. I say I have 2 full-time jobs. I have a full-time job that I have here, but then I go home and then, I have a full-time, I'm the cook and I'm the cleaning lady, I'm the mom, I'm the teacher. And so all that, and it gets heavy on the body because we've privately have talked about this before. I would say dentally, the procedures are not complicated to do. It's not, not to disregard what I do, but it's not brain surgery, but it's the mental and physical part of it that gets a little exhausting because you have to make sure you maintain your cool when you have someone screaming their head off because you're looking at them with a mirror. So, you know, and then coming home and I'm the mom to a 2.5-year-old and all the challenges that, the, terrific, wonderful twos bring, dealing with that. And adding the fact that I'm an immigrant in a country where I don't have any family. My sister lives here. I said that before, but my sister's right now not living in the US. She's living abroad. So, that is a little different. So not having any help coming home and it's just being you and your husband having to tackle everything, it does add another level to difficulty.
Is thinking about all of the elements and all of the moving pieces that there might be in your life by being a mother, a wife, a dentist, a pediatric dentist specialist, a practice owner. a sister, a daughter, and I could keep going. Is there anything, and adding on top of that, you are in a country that is yours now, but as an international person with a foreigner background, is there anything that you wish you knew or any piece of information that you were like, why was this missing?
I guess someone should have told me that it's exhausting. Um, well, I think being a working mom is gonna be, I don't want to say difficult. I want to say challenging because it is challenging. I feel like right now with all the movements, feminist movements and this and that that I approve and applaud 100%, it also puts a lot of pressure on ourselves to we can't say that we're tired or we can't say that we don't want to seem weak or we don't want to seem, yes, we can do all these things, but yes, it is okay to be tired and to find it difficult sometimes and to find it a struggle to juggle all these things. We're not going to get a prize for being superwoman. We are all super women. We are all capable of doing everything. Um, but it is hard and it is challenging. It is okay to put yourself, give yourself a break or ask for help. I think that the hardest thing in all of it is actually it's the immigrant part. It's being alone in the sense of you don't have all that extended family that you might have had in your country that could help you, because for example, here it's my husband and I. So if Diego, which is my son, my 2.5, if he gets sick, either I need to take off of work or he needs to take off of work. There's no grandma, there's no aunts or uncles, you know, no neighbors that you've known your whole life because you haven't been here your whole life and didn't grew up with these people. You might have a good relationship, might be a good relationship, but I particularly don't feel comfortable leaving my 2.5-year-old. Maybe when he's 5, 6, 7, where they can tell you, they can say, oh yes, I had a good time, or I didn't like this or I didn't like that. Right now, my 2.5-year-old can't really say all that. I don't feel comfortable, you know, leaving them with strangers. So that I would say is the biggest challenge, um, which isn't pertaining just because I live in this country. I say if I lived in any other country, it would be the same just because I don't have my extended family here. And adding to that, the fact that I'm a business owner makes it harder in the sense that if I take a day, it's not just I'm not getting paid or I'm not making any money that day, is I got to make sure my staff. So I'm not only not making money, but I'm losing because I have to pay my staff, because I'm taking a personal day. They don't have to suffer because of that. So my advice would be stay at a corporate where you're another employee and it doesn't it, not everything falls on you. And I know that wasn't your question, but that's two different aspects where you can practice here in the US. You could either be a business owner or work for, either a big corporation or a private office that offers you. And again, because I didn't practice in Venezuela in a private setting, I don't know if these options are the same over there. So when I came back to Florida after my residency, I started working with a corporation. It's basically a corporate that just has offices for pedo and ortho, which also made practicing sort of like complete because you have the needs of a growing child are all in one place, which is pediatrics and orthodontics. Yes, they might need a endo once in a while or an oral surgeon, but it's basically, pedo and ortho what they're going to need. So that made it pretty integral. And yes, you're the doctor and you're important, but you're also just an employee. So things don't crumble when you're not there. In my office, they do crumble when I'm not there because I'm the the pedestal where everything sort of falls into.
And you're the only dentist in that office? I didn't ask you that.
Yes, right now I am the only dentist. Um, we're hoping probably by the next year, if not in 2 years, to add someone else. You want to make sure you have a good base of patients where you can bring another practitioner because if not, then what's the point of, just diluting the patients? But yes, we do want to bring someone else. So I would say it's just being the immigrant that makes it a little bit harder because it's two full-time jobs. I have my job as a dentist, 8:30 to 5, Monday through Thursday, and then I have my other job being a full-time mom, wife, housekeeper, cook, everything.
And in none of these two jobs, you can get sick days or get any.
No, no. I'll no sick days when you're a mom. There's no sick days when you're the cook. I mean, you can order takeout, but then that's gonna get expensive in the long run. So, um, I think that's the biggest challenge is not having the help and balancing that whole. I love my career. I love what I do. I've worked so hard. I've trained for so long to get to where I am, but I also love my son and my family and I've wanted this for so long and just finding a balance where you can have the both. So that's what I'm saying that women we can do it, but we also better allow ourselves, the the moment or the space to say like, man, this is a lot. I'm exhausted. I'm tired. Like, I need a break or I need some help. And that doesn't make you less of energy in any way.
I think part of that, and I'm glad you're just exposing and showing that vulnerability because we have this image that because we are women or because we are immigrants, we have to live up to some standards that are always somebody else's standards, right? So if you are the wife or if you're the mom, you have this image in your head of what kind of mom do you want to be or what kind of professional you want to be. And you start making a collection and it might be different for you, but I'm sure for me, I have a collection of ideas of who I want to be in every space of my life. And it's never going to be an incomplete version, by the way. It's always going to be a very detailed, very particular, very high standard version that when you start combining roles and adding one with the other, then it becomes impossible. I had a conversation this week with a colleague and she was telling me how she felt that she lived in a lie for so many years. She's going through a hard time right now with a divorce. So she was telling me how for so many years she felt like she lived somebody else's life, trying to be the best mom, kids dress certain way because what are they going to think about me? House clean because what are they going to think about me if it's dirty? It's eating kids eating certain things because what if others see that my kids are eating from McDonald's and then I'm a bad mom? So like that, everything coming along with. So I emphasize completely what you said, and have I cannot imagine.
Yeah, and it's funny you say that, but then because that happens to me, especially I feel like I want to say a little bit more in my professional life, just because that's where I think I haven't reached all my potential. And I'm not blaming the fact that I'm a mom. I've chosen to be a mom and to be the most present mom that I can while having a full-time job and a career. But yes, I do have an image of, oh, I see other pedos doing this or being more active in social media or doing more CEs or, training yourself in a particular area that you want to, excel a little bit more. But at the same time, right now, I feel like for me, it's more important to have a balance where I can be with my son a little bit more just because of his age. This is why I tell myself all the time, like, there's going to come a time where he's not going to need me this much. I'll have more time for myself. I'm still young and I have a long career still ahead. So I can get to all of that. I feel like sometimes it's the immediate. We want everything right now. And I feel like that's a thing that started with our generation and getting even worse with Gen Zs and all these because they have access to so many things like that we just want instant gratification for everything. And we have to understand that it's a journey. You're not going to become the best version of yourself, whether it be a dentist or it be a mom or there be a wife today. It's a road that you have to, and knowing that your career as well as your life, it's gonna go through your different path. It's gonna go up, it's gonna go down, it's gonna stay static for a while, and be okay with that. Understand that, if you're in this spot today, this isn't everything. There's before everything that happened before that spot and everything that's going to happen after. So just you just got to be okay with where you are. But you're right. I mean, I go through moments where I'm like, oh man, I wish I could be doing like I see, all these courses people are traveling and doing all this and doing all that, and I'm like, well, but I had to go watch a movie at daycare with my son. That's what I wanted to do and what I needed to do today. Maybe in 2 years it'll be different. So it's just making sure that you're okay with where you are at the moment, knowing where you want to go and having a plan, but knowing that it you will get to that spot. It's maybe not going to look the way you thought it was going to look, and that's okay.
Yeah.
And I learned this with my husband. We've always joked that we've always, knock on wood, have been able to get everything we want to, whether it be material, whether it be relationship wise, health wise, whatever. We've been very fortunate to accomplish all those goals. It has never been when we wanted it or how we wanted it. Never. So, you know, I feel like for all those international dentists that are coming, just know that. Just know that if you want it bad enough, it will happen for you. You have to work towards it. You have to apply yourself. It will happen. It might not happen the way you thought it was going to happen or when you want it to happen, but it will happen. So just keep on it.
That's a great ending. Actually, I normally you have final advice, and like I'm already taking notes for what you're saying, and it's so important. And I don't want to extend from here because I think that's just a perfect ending. But embracing the where you are and understanding that everybody's path is different in this journey. So part of the reasons why I made the podcast was to even illustrate that. How can you just say, "Oh, everybody's life is different"? We all know everybody's life is different, but until you start seeing other people's life, you understand the value of what you have or what you don't have. And then you start understanding also what are the opportunities and so on. So I think illustrating this path, showing perhaps what you have done, your challenges, is doesn't mean that it's going to happen exactly for somebody else that does exactly the same thing you did, but it does mean that there are options, right? And it opens it to the point of embracing what those options are and accepting what the path could be for you.
Yes, and that's something we actually talk a lot with. Uh, I have two stepdaughters from my husband's previous marriage, and the oldest one is 15. So she's in 10th grade, which would be a junior in high school. There's 4 years of high school here. So she's in the second year of high school. So she's starting to, think about a future and colleges and this and that. And so she's always like, oh, I want to go to Yale or I want to go to Harvard. Or I want to go, one day I asked her, so why Yale? Why Harvard? Well, because they're the top. But what do you want to do? It doesn't, it doesn't necessarily mean that you're going to have the best if you go to the best. You need to find what is it that you want to do, to learn, to, you know, down the road, and then find what's the best for that. Because the best for that might not be Harvard, believe it or not, it might be somewhere else. So don't don't cage yourself into thinking that there's one way to do things or there's the one way where you're going to get to that spot. There are a million different ways where you can get to that. You just got to know. And I think that's the hardest part for most of us is doing the work in and, being true to yourself and be like, hey, no, maybe everyone else is saying that I'm good for A, but maybe B is where I'm all happy doing B. Okay, so find B and then look where the best place for B is and then just try to get there. Like you said, there's many different ways to get, and someone might do the same steps I did and not end up where I am and completely different path, and that's okay.
Mm-hmm. Which, bringing it back to the topic of dentistry, it might or it might not be dentistry. I have several others in this season talking about other career paths as well, and the corporate world of the business of dentistry without actually doing the dentistry.
Yeah.
So we did so many trained people like dentists to do other things as well, because there are not many, let's say, experts in dentistry or even professionals in each area working on companies developing products. Like we complain that the ones that develop the products are not dentists, but how many dentists are actually working there? So they're actually
Working there, yeah.
many spaces. I think there are many spaces. As you told, your stepdaughter is just finding really not what everybody says that you should do or whatever it says is the best, but what is really the best for you.
What is really the best for you? Yeah, and yeah, on that area that you're talking about developing tribes, I feel like there should be more dentists that focus on practice management and managing skills on the business side of dentistry that we don't get trained in. So you know, uh, just like you said, yes, we complain about the products and we complain about this and that, but if not not many of us go down that path, then we're not going to have the other area. So yeah, I feel like that's another great thing that you can expose to all those thinking about a career wherever that may be or may look for them here in the U.S. in the dental field. That there are not just sitting at a chair with a handpiece, treating the patient.
That for sure. Well, Dr. Bracho, I stole enough of your time today. I know you have to go back to your
I
task.
have to go back to, I need to put on my mommy hat and my cook hat and all those other hats I have here at home.
And I do want to thank you for sharing a little bit of your life, your experiences, and empowering those looking into a career in the United States as a dentist or as a mom, working mom, and so on.
Yes, thank you so much for having me. I mean, the fact that um I've seen you personally grow not only in dentistry, which is something we shared together, or because we didn't even touch on that. I don't think we had enough a podcast long enough to cover our previous history, but knowing you for so long and seeing everything that you've accomplished, it just makes me feel proud to say that you're my friend and to see that you're not only keeping your talents to yourself, you're opening them, graciously to everyone that wants it or that needs them. I honestly am so proud of you and I congratulate you from the bottom of my heart.
Thank you. I wasn't supposed to cry, but
Me, there's almost
nobody's crying.
that Botox right there.
Well, thank you again so much. I appreciate you very much, and I can't wait to see you in person. But thank you for your
Yes.
time.
Un beso y un abrazo.